Thank you so much for inviting us, the Ministry of Health, to grace this occasion, celebrating the work that CHS has done. Thank you so much also for observing the COVID protocols. I think it becomes important for me to continue to remind us all that the situation is a bit dire in the country. I'm just from Kenyatta National Hospital, that's why I'm late. And in Kenyatta National Hospital, we have close to 24 staff who are admitted now on oxygen. So the situation is dire, and we need to be careful. We need to continue observing the protocols, continue masking, continue sanitizing, continue washing your hands. But perhaps even also important is continue celebrating the work that CHS is doing, because it forms an important cog in ensuring some of our vulnerable members in this community are also protected, continue to get care with very minimal disruptions in this new age of COVID-19. And so that is why we are here as a ministry, because we believe in what you're doing, we celebrate what you're doing, and we want you to continue doing what you're doing. I'm pleased especially to be here with my mother. When I came in, I asked her, have you been doing good? And she was doing a little negotiation with me, telling me we can go right now and get that job. It's very, very important. When the time comes and we are onboarding those over 50 years, those with chronic conditions, we really require you, CHS, to go beyond your mandate of HIV and TB and sensitize your groups, those communities that you work with, particularly the cohorts that you work with, to present themselves and come forward. And so allow me to read the speech of the Cabinet Secretary. I'm here by delegation. And he says that the Center for Health Solutions, CHS in Kenya, has been a trusted partner of the Ministry of Health since the organization's inception in 2010, and has been offering supportive functions in HIV/AIDS, TB management, such as laboratory pharmacy systems, monitoring, evaluation, human resources for health, healthcare financing, leadership, and governance. And the Ministry of Health appreciates these efforts graciously. Ladies and gentlemen, Kenya committed to the UN AIDS 95 targets to fast track and accelerate action to end the AIDS epidemic by 2030. To attain this, we know that we must work hard to sustain HIV prevention efforts, because they play a key role in controlling HIV and TB. And our success indeed is pegged on close collaboration and coordination between service providers, ourselves, our communities, and our patients. And this can only be possible through continued collaborative efforts between the Ministry of Health, key stakeholders such as the County Government of Makueni, which is here present today, partners, developmental agencies, as well as implementing partners such as CHS. I'm sure we're all aware that we're in the throes of what we're calling a double pandemic. We're still battling infectious diseases, NCDs are creeping up, and now we have COVID-19. And so this pandemic continues to test the resilience of our health systems, and I'm happy to note that implementation of guidance issued by Ministry of Health in the advent of COVID-19 has been well executed. And these guidelines have ensured minimal disruption of services for people living with HIV and TB. And I do commend CHS and other partners who have continued to support the country at this critical time. When I was coming here, I was quickly appraised of some of the work that CHS has been doing, the targets that they've met, some of the innovative ways that they've been able to respond due to the COVID-19 disruptions, to the point where we are asking ourselves, is this the time where perhaps we allow multi-dispensing of drugs and commodities for our patients, as opposed to having them coming in every other month to the facilities? And perhaps, and I was asking the lady who received me, doesn't this mean that we need to continue with this as the norm then going forward? Identify those who are nearly suppressed in terms of viral loads, and give them their medication. lessen the workload for our healthcare workers, ensure we have good surveillance mechanisms to monitor them when they're at home, and move in this sort of new, efficient, disruptive way of COVID-19. And so I do thank CHS for showing us that it is possible to have that mechanism. And so at this juncture, really, it is to appreciate you all for being partners, for collaborating with the ministry. One of the key things that Waziri wanted me to mention is the issue of local manufacturing. I know you're an implementing agency, but one of the things we want you to champion, particularly when it comes to HIV and TB programs, is a local manufacturing of commodities that, one, promote our local economy here, that promote our industries, but also, in the age of COVID-19, perhaps teach us what is called self-reliance. Many of you may not know, but last year, we actually had resources available in Exchequer, but we struggled to get commodities in the country. And that therefore served as a big lesson for us, that you can have the resources available, but you will not have those commodities because you're relying on other people to avail them for you. And so in this regard, we are aware MOH put in place allocations of close to 1.2 billion for the purchase of cotrimoxazole for people living with HIV and AIDS. And we are proud to announce that now we've identified local manufacturing companies that will have the capacity to manufacture this commodity, therefore avoiding stockouts and reducing the costs that are spent on importation of this important drug. And this is an area really that we'll continue to look at to ensure that we facilitate those critical ART commodities to ensure that they're available for our community. And so I thank you so much for your collaboration. We continue to encourage it, we continue to welcome it. We also remain available for any game-changing, innovative ideas, such as those that have been implemented by CHS, for adoption in the ministry and for scaling up such interventions.